Good afternoon, everyone, and welcome to A Gathering Place. And of course, on every fourth Wednesday, even when a holiday is happening, we'll bring you public health awareness. My name is Marilyn Hemingway, your hostess, and this show, A Gathering Place, is brought to you by the Gullah Geechee Chamber of Commerce, and we're looking forward to our special guests to talk about health insurance open enrollment that's happening right now, and of course, what's going on during the holidays regarding our health. Looking forward to it right after this opening.
Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you'll learn it all.
And people are
Good question.
Well, we're back, folks, so we'll just go ahead and bring in the first special guest to join us to talk about open enrollment, Miss Sarah Christian. Sarah, good afternoon. Happy holidays. Happy Kwanzaa, because it's the third day of Kwanzaa. And we're just delighted that you are here to join us today to talk about open enrollment. So, Sarah, before let's get started, let's learn a little bit more about you. You are a navigator, health insurance navigator. Am I correct?
I am a certified navigator, but I mostly coordinate the program and help provide technical assistance to the other navigators located in the state.
Very good, very good. And we're hoping to bring on Linda Lina also. Let me see if she could get here. Hold on. Hello, Linda. How are you? All right. Still working on that audio? All right. You're muted right now. Gotcha. Okay. So let's go ahead and we'll continue the conversation with Sarah while you work on your audio. All right. So Sarah, where are you located? What is your territory?
So I'm located in Columbia, South Carolina, and then all of our other navigators are located throughout the state. So we are serving statewide, even if we have a certain location we're at.
Okay, so navigators are located throughout the state. So what are the roles of the navigators in health insurance open enrollment?
So their role is really to educate, answer questions people may have on what the marketplace is. And if someone is needing health insurance and they're interested, we can enroll them, help them with that application. And what's nice is that assistance is free and unbiased. So we're not going to charge them for answering questions or enrolling them. And we're not going to push them or steer them towards a certain plan or insurance company. And that might be the case in other situations, but for navigators, we don't do that.
All right, very good. So if I wanted to work with a navigator, how do I get in touch with a navigator?
So since we're all located in different places, everyone has like their own phone number, but a good way to find us all is on getcoveredamerica.org. So you can just type in your zip code and it'll pop up who's in your area that can assist you, and it provides you all the information you would need to contact that person or schedule an appointment.
So that is getcoveredamerica.org.
Yep, all one word. Yep.
All right, so y'all, if you wanted to reach out to a navigator and receive help during open enrollment for your health insurance, you could go to getcoveredamerica.org. And I'm assuming, Sarah, they would go to the state of South Carolina, and from there, they can narrow it down to their territory. For example, if you're in the low country, there are navigators that cover the low country, and you can navigate your way there.
Correct. Yep. You can type in your zip code of where you live, and what will pop up is in your area. And maybe you type in a zip code, and that navigator pops up. Maybe you feel it's a little too far away. I don't want that to steer people away from the program, because we will travel to you to meet you where you're at, so you don't have to travel to us. We can meet you where you're at and work around your schedule and find something that works best for you if this is something you're really needing and wanting.
Well, that's good to know that you will come to where people are to help them get enrolled. So let's talk about open enrollment. What is open enrollment for health insurance?
Yeah, so right now is open enrollment. So that's pretty much a time when anyone can go in the marketplace and see what their options are. But outside of open enrollment, you have to have specific criteria to meet to be able to enroll. So this would be the time if you're thinking about it or wanting to enroll is right now.
So I know there are some deadlines to meet. For example, if you wanted your health insurance to start January 1st, 2023, you had to get enrolled by what date?
So yes, that day has already passed. You would have had to enroll by December 15th for that January 1 coverage. And so now open enrollment will end January 15th. So as long as you enroll by before it ends, you will have coverage starting February 1st.
Okay, so this will be just a 1 month difference if you start enrolling now, if you get enrolled now. Before January 15th, your health insurance will kick in February 1st.
Yes, that is correct.
All right, very good. And there are different types of plans. How are um plans determined that are appropriate for an individual? What are the criteria?
Yeah. So when you start the application, you'll share your income information. Then they'll do like an eligibility notice, and it will let you know what you're eligible for in terms of premium tax credits, and you can accept those. And then when you go in there to look at the plans, it will show you what the cost would be for your premiums or deductibles, and it would allocate that if you were eligible for any cost savings. It would allocate that into the plan option. So it's nice because you can kind of filter and compare what you're looking for. If there's a certain price range, or maybe you want certain doctors or prescription drugs covered, you can compare all those. So if you want a low cost plan, we can just look at the lower cost ones, or whatever meets your needs. We can compare those.
So, as a navigator, you help individuals navigate through the process of enrolling, but you can't recommend the health insurance itself, but you can help them navigate through the process. Is that how it works? Kind of sort of?
Yes. Yeah. So we can answer questions on what certain terms mean, like premiums and deductibles and all of that. But yeah, we won't tell you to, oh, you need to go through the cross, or you need to go with this. You know, we will present you your options and explain what stuff means, but it's ultimately the consumer's choice on what they want. So we're not going to tell them which plan's better or which one we think they should go with. It's ultimately their choice.
Okay. All right. So let's try to see if Linda did she get her audio straight? Hold on 1 second. Let's try her again. Linda, did it work? No, no, no. I don't know what's going on. All right. And I cannot unmute you. So, Linda, thank you for hanging with us. I know Linda's going to be in the background, and I'm going to try to call you, Linda, and see if we can work it through the phone. But you stay there, all right? I'll call you in a moment. All right, Sarah. So, Sarah, what other deadlines do we need to know about for this, or have we covered all the deadlines? Are there any other deadlines we need to be aware of?
So yeah, January 15th, since we're kind of coming on the end of open enrollment, that's the most important one. If you're trying to get coverage, that's when it will be, because after January 15th, it closes, and you would have to have certain criteria to be able to enroll into a plan outside of that. And, you know, we're here year round. So if that happens where you didn't end up getting enrolled or something happens, maybe you lose insurance, we could help you navigate that and potentially apply outside of open enrollment.
All right, Sarah. So I want to get enrolled. What type of paperwork do I need to bring with me when I'm going through my enrollment appointment?
So we always say, especially if you're new to the marketplace, maybe you've never set up an account, just knowing or bringing information about your household, your income, maybe because it is a projected income for the coming year. So, maybe last year's tax return or something can help you think about what you made last year and what you think you'll make in the coming year. Any contact information, addresses, anything that's applicable that you would be filling out about yourself or potential dependents or family members. So yeah, if you know that information, great, but maybe if you need to jog your memory, definitely bringing that type of stuff in will make the application process go a little quicker for you.
All right, very good. So you heard that, folks, the information that you needed to bring with you to help your appointments go a little bit smoother and quicker. And Linda, we're going to try to bring you on with the audio. Can you say something, Linda, and we'll see if Sarah hears you.
Hello, everyone.
Sarah, can you hear Linda?
I can hear her. There's a little bit of an echo, but I can hear her.
All right. So Linda, what information do you want to share with those who want to participate in open enrollment at this time?
One of the things that I want to make sure people are aware of insurance fraud. Unfortunately, it is happening. Because one of the things is they're asking for your information, and that information can be used for something to, invade your privacy or whatever. So when you are talking with someone, make sure you feel comfortable that person is who they say they are.
All right. Very good. Very good. Thank you, Linda, for sharing that information with us. Sarah, what do we need to know that we haven't covered today regarding open enrollment?
I would just say, yeah, it's ending soon. That final push, please call us if you are wanting to know more information. I would say just reminders too, if you are unaware of what the health insurance marketplace is, it's really an option for people who may not have health insurance options elsewhere. There are cost savings to reduce those premium tax credits and other reductions like with your deductibles. And what's nice too with the health insurance marketplace, it is going to cover the 10 essential health benefits. So it's not going to discriminate against you if you have pre-existing conditions. It's going to cover all those things you need for healthcare.
Yeah, that's the wonderful thing that I like about the Affordable Care Act law that was signed in by President Obama, that it removed the pre-existing conditions. And that's huge for millions of Americans that, that pre-existing condition caveat was removed towards getting your health insurance. That's a game changer for millions of Americans. And I, for one, personally use it. I would not be an entrepreneur if it was not for the Affordable Care Act that affords me to have health insurance. So I really appreciate the work that the navigators are doing. So Linda, what is your territory? You are a navigator. What is your territory that you cover?
Basically, as a navigator, we can assist anyone anywhere. But as far as the local area, Georgetown, Berkeley County, Charleston County, are the local areas that I am able to assist. And as I indicated, if I need to go outside of those areas and assist my fellow navigators, I can do so as well.
All right, very good. So there you have it, folks. We have Sarah Christian with us and Linda Lina talking about their roles as navigators during the health insurance enrollment period, which ends January 15th. And if you want to know where your local navigator is, you could go to getcoveredamerica.org, go to the state of South Carolina, and look for your territory, your county, and they will pull up the name and contact information of the navigators who are working in the state of South Carolina. And remember, the deadline to get enrolled is January 15th. So I do have a quick question. So you get enrolled. Do you make your first payment before January 15th to confirm that you are enrolled?
You don't have to do it before January 15th. You can enroll by January 15th, but as soon as you can, after you get enrolled, you need to pay that first month's premium for it to be effectuated. So if you don't, then you could potentially be disenrolled, or it could cause issues. So
Very good. Understand what you said. So yeah, y'all get enrolled, make that first payment, and then get that ball rolling. I'm looking forward to this. Is exciting. I too I've enrolled in during this open enrollment period, and very much as an entrepreneur, small business owner, and president of many organizations, I certainly appreciate the health insurance open enrollment period and the Affordable Care Act. Linda, any last words?
Yes. What I want to make individuals aware of is that not only we help with enrollment, but we can also come out and do a program or a setup where we can set up to enroll people at your church or at any particular location that you may have. So that is available. It is available throughout the state. Correct me if I'm wrong, Sarah. And like I say, just give one of us a call, and we'll be more than happy to set that up for you. Or if you just need for us to come and speak to your group, because a lot of people have misconceptions, and they need to understand, what is available and how it works, and that there are still some programs where you only pay $10 for your payment, and in some cases you don't pay a premium at all.
Very good, very good. Thank you, Linda. And Sarah, any last words that we need to hear from you regarding open enrollment and health insurance?
yeah, just to echo what Linda said, we're statewide, we will travel wherever, and people might have the conception if they talk to us or meet with us that they have to enroll. It's not the case. And like Linda said, even if you just want to educate and spread the word to your community, we will set up and give a presentation, hand out our information. Just because you interact with us or talk to us doesn't mean you have to enroll. It's just good that we're passing along the information so that people would like to enroll, they have that information, and it's the correct and accurate information. And again, with Linda, insurance fraud, there's other things going around. Like, we are a trusted source.
Very good. Thank you, Sarah. Thank you, Linda, for joining me today. Everyone, getcoveredamerica.org. What a great name of a website. You can't forget that. Getcoveredamerica.org. Go to it now. If you do not have health insurance, excuse me, get enrolled. And that little cough might have been an advertisement for why you get health insurance. Getcoveredamerica.org. Get enrolled. Make that first premium payment so you can meet that deadline of January 15th. And I went through it myself. Actually, done it multiple times over the years, and it's not as hard as you think. And we really appreciate our navigators across the state of South Carolina. Thank you, Sarah. Thank you, Linda, for joining us today in the midst of the holiday season. And hope everyone had a wonderful Christmas, happy Kwanzaa, and of course, coming up this Sunday, a happy New Year. We'll see you in 2023. Thank you, Sarah. Thank you, Linda, and have a good evening.
Thank you.